touch on data that's just recently been published, so you'll get a little bit of a glimpse of what's going on internationally. And I'm also going to share a few resources. Now, we sent these out to you in an email, so you've got the URLs to these resources, so you'll be able to look at them yourselves. So there are 2 papers, both are open access, so you can download those. One is a resource on vaping and pregnancy, and the other is a list of YouTube videos developed by the National Centre for Smoking Cessation and Training. Okay, so we'll touch on those as we go through. So first off, just a refresher on the current legal status of vaping and indeed heat not burn products. So you might remember a few months ago, there was a court case, Philip Morris versus the Ministry of Health, who were prosecuting Philip Morris for unlawfully selling heat not burn products. The decision of the court was in favour of Philip Morris, which means now that vaping and heated tobacco products may be legally sold, imported, sold, and distributed in New Zealand. Okay, so this includes nicotine-containing electronic cigarettes. So they're now lawful to import and sell. That wasn't the case before. Now, the implications of this particular decision is that the same Smoke-Free Environments Act regulatory controls that apply to tobacco now apply to heated, not burn tobacco and vaping products that are manufactured from tobacco. Okay, so if these products are manufactured from tobacco, then the same Smoke-Free Environments Act legislation applies. So this would include a ban on the sales to people under the age of 18 and restrictions on advertising. But what doesn't apply is the ban on smoking in indoor workplaces, early childhood centres and schools. This only applies to smoking because smoke is produced, obviously, and not vaping products or any products that aren't smoked. Now, that's not to say that, of course, individual employees, businesses can decide whether they restrict vaping indoors as well as many do. Okay, but technically the legislation doesn't apply here to vaping. So that's the current legal situation. I just want to look at some of the data again on does vaping help people quit smoking? Because depending on your views, you'll hear some people say there's just not enough evidence at all to support this. Others say, well, look, there is some data to support this. My view on this are twofold. One, vaping is a very popular way for people to go about quitting smoking. A lot of people who vape say they're vaping to quit. And we know that vaping can help some people to quit smoking. And you'll know of people that have vaped and have actually quit smoking. But of course, it's no magic cure. Not everyone that picks up a vaping product is going to spontaneously quit. Now, just to show you, these data are from the UK, but just to look at the first concept of popularity. This graph here is showing you prescription medicines over time, and the brown dotted line is e-cigarettes. Now, these data are a bit old, but here's 2012, so 6 years ago now, and you can see this big increase in the use of electronic cigarettes or vaping products in a quit attempt. So massive increase. Prescription medicine started going down then, nicotine replacement therapy on a prescription started going down. Here's over-the-counter NRT, bought at supermarkets or pharmacies, heading down. And here's the proportion of people using stop smoking services also going down. I suspect we might be seeing a little bit more of this in New Zealand. For those of you working in stop smoking services, might have experienced a little bit of a dip in the proportion accessing. So there's no, absolutely true that e-cigarettes are a popular tool to help quit smoking. Now, in terms of do they help people quit, we still only have 2 good quality published randomized controlled trials, which are in the Cochrane Review, that showed that nicotine-containing e-cigarettes were significantly better than non-nicotine e-cigarettes at helping people quit smoking for at least 6 months. There will be some new data coming out this year, hopefully soon, which will add to this. These data here, published in Tobacco Control in March of this year. This is a population survey. It's a longitudinal study. So they follow people up over time. And the conclusion of this study was that daily e-cigarette initiators, so people that started using e-cigarettes, were more likely to have quit smoking cigarettes or reduced consumption with non-users. Okay, so that's saying that actually it seems that e-cigarettes might help people quit smoking. But just a caveat here, and others have found the same thing, it's daily e-cigarette use that's needed. If you're just using, if you're experimenting it or just using it every now and then, you're probably not going to quit smoking. And that might be because people just don't want to quit smoking. If you're just using it when you can't smoke, that doesn't necessarily mean that you want to quit, obviously. So what you're seeing here is the probability of quitting smoking. Here's an everyday user versus a non-user, and you can see the significant increase or increase in the probability of quitting smoking if you're an everyday user. Looking at reduction, so at least 50% reduction in cigarette consumption, daily e-cigarette use also helped with that. Okay, so I think it's fair to say that there's growing evidence that vaping can help people stop smoking and also reduce. Now, this was this is just a small pilot study with 50 smokers with a psychotic disorder. So this was done in the UK, and they want to see what difference giving a free supply of e-cigarettes, and they just got a free supply for 6 weeks, made on cigarette consumption. So this is e-cigarette use per day. They sort of translated puffing to smoking. And this is cigarette consumption. So you can see here at baseline, before they received the e-cigarettes, they were smoking just over 18 cigarettes per day on average. And then when they started vaping, you can see a significant reduction in cigarette consumption, almost halving. You can see what happens when they stopped getting their free e-cigarettes. They stopped using them pretty much, right down. So in this group, and you may not be surprised, of course, those with mental illness are not always able to perhaps afford these products. But you can see here, once they stopped, cigarette consumption did sneak up a little bit, but it was still significantly less than baseline, all the way up to 24 weeks. Now, I'm just going to put this out here because you will read evidence to the contrary. And this was another longitudinal study published in July, early this month. And this study looked at smokers, followed smokers up over a year. So they took smokers at baseline and they followed them up for a year, and they measured not smoking in the last 30 days at 1 year follow-up. Now, in this study, they found that those who were vaping at baseline had lower 1 year quit rates, although 9.4% is pretty good at a year, I would think. I think most of you would agree. But those who did not vape at baseline had this massive, almost close to 20% 1 year quit rates, which is a bit unusual as well. So the conclusions from this study is that actually vaping didn't help people quit smoking. But I just want to point out a few limitations of this type of research because it's been sort of happened before. And you can imagine that this type of research, when you're taking just smokers at baseline, you're of course excluding all those people that have successfully stopped smoking with vaping anyway. So those who vaping did work for are no longer in your sample. That definition of vaping is also important. As you saw from that previous work, it was actually daily vaping that was most important. This particular study included people that had even rarely vaped as vapers at baseline. And I think the other thing just to be aware of, if you've got people vaping and smoking at baseline, they may be these people that are just happy to be dual users. They want to carry on smoking, but they just vape when they can't, i.e. they're not really that interested in making a quit attempt. And the other group is, of course, those that continue to smoke because they just find stopping smoking so difficult. So it's where vaping perhaps hasn't worked very well for them. So these are limitations of this type of research, and to be very certain about whether something helps someone quit smoking, you really need to take a group of people that want to quit smoking, then randomize them to either receive vaping products or not. And I think today we should be randomizing people to vaping products, and the control would be usual care, so a combination of stop smoking medicines and behavioural support. This study, published this year as well, looked at barriers to vaping. This was a survey. They had 446 respondents who were smokers. 201 had tried vaping. Of those that tried vaping and then stopped, these were the top 3 reasons for stopping vaping. Not as effective as cigarettes, 72%. So people are saying, look, they're just not as good as smoking. And we've been there with nicotine replacement therapy, right? We often have people that say, I tried gum, didn't help, it wasn't anything as enjoyable as smoking. And this is still the case with many vaping products. Also, the initial cost, 24% said it was the cost that was a barrier, and 23% raised health concerns. So they stopped vaping and went back to smoking. So you can imagine the health concerns need to be put into context. Now, I found these data quite interesting, and I've titled this "Persistence is Required." Now, this was the days to settle on a dose and setup of the device. You can see here that very few, well, not very few, around a fifth of people managed to sort of get it right in the first day. But most are here in the middle, taking perhaps up to a month of finding the right dose, the right flavor, even the right device. So when you're talking to people about vaping products, don't forget to say, look, you might need to try a number of different flavors or strengths before you finally find something that's right. And just on that note, with strength of nicotine solution, I'm finding a lot of people in my practice are starting on low concentrations. They're sort of going with 6 milligrams per mil. And then they're finding they're getting through their bottles of e-liquid pretty quickly. In that situation, you might be better to say, look, try a slightly higher concentration, maybe 12 or 18 milligrams per mil. You know that smokers compensate. If there's not getting enough nicotine, they'll need to vape more to get the nicotine that they need. They'd be better off starting on a higher concentration and vaping less. Of course, you have to balance the higher concentration with perhaps the more unpleasant effects that is associated with. Safety. How safe is vaping? We know the health risks of smoking. We know those very well. And those risks of smoking are a result of products of combustion. Okay, so it's the burning that causes the problems. You all know this. Now, as there's no combustion involved in vaping, there are significantly fewer toxins produced. But of course, vaping's not completely harmless. It's just much less harmful than smoking. Okay, so for smokers, there is a risk reduction. For people who have never smoked, there's going to be some risk. We don't quite know what that is yet, but we should discourage vaping in people that don't smoke. Now, this might be useful when looking at trying to put across the degree of risk. Now, this is, I've sent you the URL to this paper. This is an open access, and this figure is in the paper, and you can download it as a high resolution figure. But it's looking at the spectrum of harm. So here's no harm, no use of anything. Here you've got your nicotine replacement therapies here. These, of course, are not without harm. They're pretty harmless. On a scale here, you can see they're very, very low harm. Here's e-cigarettes that sort of sneak in here. Here's smokeless tobacco, and here's your combustibles. Okay, now this is just to put it all into perspective. Okay, so you can see vaping not harm less, be better to be using nothing, but in comparison to your cigarette smoking, it's right up there. Water pipe smoking, just to mention this because I know a few people do use water pipes. They are not harmless and are seen as certainly more harmful than the nicotine-only products down here. Now this, from the same paper, I think is quite a nice way to try and look at how we might get people to switch. And this is now looking at a 3D approach by harm along this axis. So here's no use down here to combustible products. Here's the appeal. Unfortunately, nicotine replacement therapies don't have a lot of appeal. People don't find them particularly satisfying. Cigarettes, on the other hand, are quite appealing. Here's smokeless tobacco that would sort of be planted here, and e-cigarettes, not bad really on the appeal. And this is degree of dependence. So part of this is related to satisfaction, right? So you're more likely to use something long term if it gives you that hit of nicotine quickly and you find it more appealing. So this is where vaporizers, vaping products, when used correctly, this is Juul, by the way, this little device here, or a Juul-like device, can be as appealing as combustible tobacco. And that's why they've sort of called this the sweet spot. It's relatively low on harm, is satisfying, and certainly more appealing. Now, in terms of safety, I think most people agree we could improve or have something in place to try and make sure that vaping products are as safe as they could be. For example, make sure that the batteries and the electronics are as good as they can be. Make sure that pharmaceutical grade nicotine is used. Make sure that the flavors are of the best quality. And the ministry is developing some standards for vaping products. They're expected to become mandatory when the Smoke-Free Environments Act is amended. I don't know when that is going to happen. Just in terms of young people experimenting with vaping, you might have seen this on the news on Friday. And this is from the HPA Youth Insights survey, which has showed over time the rates of young people experimenting with vaping has increased. So here we go, 2012, 7%, 2014, 20%, and 2016, 28%. So we've seen this increase in experimentation occurring. This occurred in other countries as well, and probably reflects the increased availability of vaping products. If you look at young people experimenting with cigarettes, just to put this into context, here's experimentation here, 1 to 10 cigarettes in a lifetime. Not much change really over time, 18, 16, and 16. Of course, experimenting with cigarettes is far more likely for people to go on and become regular smokers. Now, just to what the HPA Youth Insight Survey doesn't give us is the experimentation in smokers versus non-smokers. Okay, because that's important to look at. Now, I'm just showing you here experimentation of vaping in a sample of a number of surveys from the UK. And you can see that in young people, experimentation was somewhere between 7 and 32%. So not so dissimilar to what we're seeing in New Zealand there. Here's regular vaping and regular smoking in the same sort of age groups. So regular vaping is much lower, of course, than experimentation. But what you really want to know is what was the smoking status? Because if regular vaping is occurring in smokers, well then that's okay. That's kind of that harm reduction approach. If regular vaping's occurring in never smokers, well then that's more concerning. So if we look at this, here's never smokers experimentation. So never smokers do experiment, 4 to 14%, but this is regular use in never smokers. So really under 0.5%. So there are a few, but it's very rare that young never smokers are regular users. Most of the regular vaping occurs in people that are regular smokers. So when you're looking at these data and you hear it on the news, you do really need to put it into a little bit more context about, well, is this regular use or experimentation? Where is it happening? Who's doing it? And don't forget that, of course, kids try stuff, and kids that try vaping are probably the same kids that are also more likely to try smoking. Okay, so what should we do now? Well, I think with the change in legislation, smoke-free policies really do need to be updated now. I know many do include vaping, but they should keep on, progressing and include what we do with heat not burn products. It could also be an opportunity to look at what you might allow in terms of vaping. So, for example, would you allow people with mental illness that are admitted to hospital to vape in indoor spaces, vape in spaces that might be outside but are still on hospital grounds, versus no smoking at all? So could you change the policy to perhaps allow people to switch from smoking to less harmful options? In terms of health practitioners, and this applies to stop smoking practitioners as well, we need to be providing accurate information to people about vaping, including the relative risks of vaping versus smoking. I think the advice, if you're going to vape, aim to stop smoking completely. Of course, this may take a little bit of time for people to make that switch. And in an ideal world, aim to stop vaping eventually as well. Although I think this, again, like NRT, I always say to people, just use it for as long as you need to feel safe that you're not going to go back to smoking. Stop smoking services, we should all be becoming e-cigarette friendly. We should be looking at our data. I spent our last few days looking at our Counties Manukau service data, looking at e-cigarette use. Still working on it, but the data are looking quite interesting. Need to provide accurate information about vaping, including some of the safety tips, I suppose, on vaping. And we also need to support people who choose to vape to go about getting their product. And I know this is quite difficult for us because most DHBs can't have a preferred vaping provider, but perhaps we should take that step and look at which vaping retailers we might choose to send people to. This paper is recently published as well. It's an editorial. It's freely available, so I suggest you take a look at it. it did give some useful bits of advice. For example, they say more advanced models that deliver nicotine more efficiently seem to work best for those trying to quit smoking. So that's more or less saying you should probably use one of the second or third generation devices as opposed to those cigar-like type devices. That people should carefully read and understand the manufacturer's recommendations for use and care of e-cigarettes. So this is something you could say to your clients. Is another good point, and you've seen the data to support this. Daily e-cigarette use is generally more effective for quitting than intermittent use. So if you're going to vape, aim to vape regularly and stop smoking completely. It may take practice. In fact, it does take some practice to use the device to get the right amount of nicotine and to relieve urges to smoke. So keep going with it. And again, you might need to try different flavors and different nicotine strength. This bit of recommendation from them was to say stop using combustible tobacco cigarettes as soon as you possibly can. And they recommend aiming to discontinue vaping when you feel comfortable that you have quit smoking for good. And I think that's a nice way to say, look, when you feel that you're not going to go back to smoking soon. And some bit of information here and advice on battery care. So avoid vape battery explosions by using devices with safety features, keeping batteries in a case to prevent contact with metal objects. Yep, some people have put their batteries in their pockets with their coins and keys. So when they're touching other metal objects, then they can spark and short and do all sorts of things. Making sure you charge the device with the charger that came with it, not just taking anything that you've got around the house to charge those. And like anything, you shouldn't leave your mobile phone charging unattended because sometimes these things do catch fire. And if you drop your batteries in the bath, obviously don't pull them out, dry them out, and keep using them. Okay, so replace them if that happens. E-cigarettes and pregnancy. This has come up recently because pregnant women who smoke are vaping. You might see clients may ask you about vaping. The evidence is not so clear on this. There is a trial going on at the moment which is comparing vaping with nicotine patches for pregnant women who want help in stopping smoking. But this resource, I think, is one of the best that's out there and really takes that harm reduction approach. So you might like to have a look at those. Here's my take on nicotine use in pregnancy. And I start off like this. It's always, of course, best to have a smoke-free and nicotine-free pregnancy. But, of course, the people we see are the women that are struggling to stop smoking on their own. And so that's where we discuss the benefits versus the risks of using NRT during pregnancy. You know NRT is not completely risk-free, and so you need to discuss that, but they are safer than smoking. And of course, if you're using patches, take those off overnight. For women who ask about vaping, I think we need to explain what we know. That is the health risks in comparison to smoking, but of course not completely risk-free. They can be helpful for people to stop smoking, but are no magic cure. I think for women who haven't really given NRT a serious try, that's where I usually start with, because that's what I can recommend. And that's what the guidelines say. But if you've got women out there who want to switch to a vaping product, then don't say, no, that's a bad thing. I think support them to do that. By providing the multi-session behavioural support and financial incentives and everything else that you've got to help get them smoke-free as quickly as they can. Just a few resources to finish off here.